Shamattawa First Nation Chief Eric Redhead is worried about his community. He said there have been a number of suicide attempts in recent months, but 2 recent incidents prompted the state of emergency.
One of the reasons why we're calling on additional supports is our health team at the local level is actually, they're fatigued. We've had multiple deaths, natural deaths in the community that affected the health staff and really the entire community. That overlapping grief for our service providers at the local level, it's just overwhelming. And so we're calling on additional supports to be provided to my members.
Chief Redhead said a mother of 4 died by suicide and a young child is in critical condition after an attempted suicide. The mother was Chief Redhead's 32-year-old sister. A request was made to Indigenous Services Canada for a child and adolescent mental health therapist, as his main concern is the youth. Indigenous Services Canada says they already have supports in the community. Quote, ISC will assist the community with securing child and adolescent expertise, and has also confirmed that Jordan's principal therapist and a non-insured health benefits therapist are present in the community to provide support during this difficult time. MKO Grand Chief Garrison Satie believes the pandemic has exposed gaps within First Nations communities, including suicide.
This is not addressed. It will only escalate, and the situation is critical. And throughout this year, the pandemic has exposed the gaps that exist in our First Nations, and mental and emotional health is an area that we really need to address, because the youth in our communities are suffering and they have nowhere or no one to reach out to.
Daryl Stranger, APTN National News, Winnipeg.